We're going to start with an introduction to omnichannel marketing. To explain what omnichannel is, I first want to talk about different kinds of marketing channels. You can think of a patient and their interaction with their doctor or a hospital as a single channel. Maybe they access a website or a mobile application, and additional channels are added to their overall user experience. Cross-channel could be the ability to go from the website to the application to the hospital or doctor, but those channels are not connected to each other. So an action you might take on the website is not in sync with an action you take in person or on an app. With an omnichannel experience, the patient experience is completely seamless and connected across all of the different touch points and channels. There are a number of different definitions for omnichannel. Ours is that omnichannel gives your target audiences a personalized, frictionless, and continuous experience with a brand, regardless of the channel, format, location, or device, online or offline. You can think of omnichannel as broken into several different components. The touch points are the places that a patient first comes in contact with the health system. In this case, that might be the website or mobile application. You can also consider this the device at which they're interacting. Then the patient or user makes some decisions about how they're interacting. Perhaps they're doing a search, perhaps they're clicking on a call out, perhaps they're taking an action in an app to schedule an appointment. The touch point and conditions provide context around the touch point. You know how a user is coming to you, what device they may be on, what application they're using. And you can use that context to tailor and personalize the content of their experience. It's always good to collect some feedback after this interaction, and that could be in the form of analytics, but it could also be in the form of a survey or a questionnaire that you're asking your users. So let's talk about how omnichannel could help boost your patient engagement. We know that 62% of consumers personalize their mobile and web experiences. This was in a recent survey from Profit. We also know that users personalize their experience not just on websites, but also through SMS alerts or reminders, promotional or product offers. They check out product recommendations and sign up for more information about specific types of products. They personalize the content that they see on their mobile devices, even down to their screen layout. We also know that consumers have really high expectations about healthcare. Of all the industries surveyed by National Research Corporation recently, healthcare was at the top of patient expectations. We also know that most patients are unhappy with the services that they receive from their healthcare providers. So there's a pretty large gap here, and we feel that personalization and omnichannel can help close that gap. So let's start talking about personalization. Personalization is a great starting point for omnichannel because it increases the value of the content that's delivered to patients. It's content that is speaking directly to their needs. The discovery of information that they want to find becomes much more efficient because it's tailored to exactly the information they're looking for instead of having to do a really broad internet search. Interpersonal communication makes consumers feel more connected to your brand, and that increases a degree of trust that they have with the healthcare system. And we've seen that personalized experiences increase satisfaction, increase patient-provider engagement, and all of that leads to higher conversion rates and longer retention. So let's talk about some ways that you can start personalizing your content. In an anonymous sense, perhaps patient acquisition, you can think of a user that first comes to your website. The first click that they take on the website, you can, at that moment, start to gather some more information about the user, the visitor, and create a profile. Perhaps they've clicked a menu item about healthy eating. You now know the topic that they're interested in. You may know that they've come from a mobile device by doing some device detection. You may even know their geolocation, the region of the country that they're in. Perhaps you have some refer information from a search engine or from refer a link on a partner site. Maybe they're clicking on some specific types of content like videos and engaging with that content. You may also be able to see if they are liking or sharing or commenting on content within your site. And as they're moving through, you can start to tailor the experience, start to serve up related articles, information of the topic areas that they're already pursuing. And they may even get to the point where they sign up for an email newsletter and specifically select topics that they're interested in. All of that information together starts to form a visitor profile that allows you to further personalize content, even for anonymous visitors. Now, when a patient signs up with your site and has a login, perhaps to a patient portal or other system, you can really start to tailor their experience because they've set up an account and are providing more information about the kinds of content that they want to see. Perhaps they're taking some quizzes, perhaps they're connecting to a wearable device that is sharing heart rate information or blood glucose information. Perhaps they've signed up for or set up a personal diet and need reminders to stay on track. All of this really gives you an ability to do a robust, personalized experience. There are a number of different ways that you can collect information about your users to further personalize their experience, and we can consider those in three different buckets: behavioral, demographic, and interest-based. Behavioral is the way that a user clicks around or engages with your website, the types of interactions they use. Here are the device detection, the types of media that they're looking at. All of this is behavioral information. Demographic, you can think again of the geolocation. Perhaps there's a language selection that a user has made here. Or if they've logged in and they've filled out a profile, obviously you have even more information to tailor their experience. And interest-based is the type of content that your patients are looking for. Maybe they've signed up for that email newsletter about healthy eating. That's a type of content. You can continue to serve up more along those lines for your users. And we wanted to share a few examples of websites that are doing some degree of personalization. Memorial Sloan Kettering has the ability to self-select right from the homepage the type of user you are when you come to the site. Maybe you're an adult patient, maybe you're a caregiver for a child or teen, you might be a healthcare professional, or perhaps a researcher. And just by self-selecting, the website can then tailor the content that you're seeing from that point forward. Kaiser Permanente has geolocation detection on its website. So when you come and click the locate a facility, it's using that geolocation to find facilities closest to you without the additional step of having to enter in zip code or other information about your location. ZoomCare is really on the cutting edge. When you come to their website or app, there's geolocation in place, and you can see doctors and their availability nearest to you. You can select the reason for your visit right from the start so that content can be tailored based on that. And you can dive in and make an appointment right from the app.
Thanks, Mike. HIPAA, high-tech, and other rules governing the storage and use of PHI are obviously a big concern in the industry. What we hear on a regular basis from our healthcare clients is that data security and privacy are two of the main reasons that health systems have typically held back from embracing CRMs, tracking browser data, and taking the plunge into personalization and market automation. But what Mike's going to talk about now is that with careful application and by following a few basic rules, privacy should not be a barrier to a successful content personalization strategy.
Thanks, Ollie. So we know that obviously security is a top concern, and it's something that we specialize in at Phase 2. That's kind of a given. You have to have a very secure system. What we're talking about here with privacy and security is really about patient perception, being transparent with your users about how you are collecting and using their data, being transparent with your users about your authentication and how data is stored, and allow your patients to opt in to use different channels or devices. An example of how you can keep your marketing data and your personal health record information separate, you can take a look at Mayo Clinic. They've got a patient portal like many health systems do, and you can log in as a patient and see your interactions with your doctor directly. But they also have a section of the site that is separate, does not require a logged in state, where users can sign up for e-newsletters on a range of topics. And you can see here that the only field they're collecting is email address. And when you keep these two types of information separate, your users, it's clear to them how you're using their data. Another idea is to take your privacy policy and rewrite it in plain language. Obviously, you may need to have a legal terms of service, but you can also take that and kind of boil it down into the most critical points to make it very clear to your users how you're storing and using their data. A lawyer in England recently took Instagram's over 5,000 words of legalese and rewrote them so that teens could understand exactly what the terms of service are for that photo sharing app. And I think that's a great idea that could also be applied to healthcare.
Thanks, Mike. So an omni-channel marketing strategy serves to project the brand of your health system in a consistent manner across multiple channels. In addition to this, though, omni-channel marketing and personalized content, they're not just marketing wins, they also serve as an extension of the continuum of care.
So we want to share a few examples of cutting-edge healthcare systems that are doing some really interesting things with omnichannel. The Cleveland Clinic recently set up an e-commerce platform called Adeo, and their users can come and purchase apps that have been vetted by healthcare professionals to help them stay on track with their health goals. And the really nice thing here is that you know that they've been reviewed by doctors and physicians, and that these are the best apps for different conditions. Another great example is Ochsner's. They set up what they call the O bar. I think many people are familiar with Apple's Genius Bar, and this works in a similar fashion. Again, medical professionals have reviewed a number of different technologies, things like Fitbit and Jawbone, Bluetooth blood glucose monitors, wireless blood pressure monitors, and wireless scales, a number of apps, including food and nutrition tracking, apps to help with fitness and activity. And they've reviewed all these devices and apps and provide this O-bar where patients can come in and meet with a technician to try out the devices and apps. And if it's one that works for them, the technician will help them set it up and get ready to go.
Thanks, Mike, and thanks everyone for listening. If you have any questions on omnichannel strategy, content personalization, branding, development, design, or anything else patient experience related for health systems, don't hesitate to reach out to us at health@phase2technology.com or myself, Oliver Tree. And please do visit the website, and we look forward to seeing you again in part 2 of this presentation.